Good evening, everybody.
Good evening, sir.
Good evening, sir.
It is a
Good evening, sir.
it
Good
is a
evening,
great,
sir.
yeah. Good evening, everybody. It
Good
is a
evening,
great
sir.
pleasure being
Good
with
evening,
you
sir.
again. I really appreciate Academy of Quest under guidance of Dr. L.M. Khan that he makes every opportunity useful for others, and every opportunity is turned into learning opportunity. Today on Dhanteras, he has enlightened us. He has rather made us rich by the Dhan on this terrace by sharing his wisdom, and gave a very, very beautiful points that we may learn any number of drugs, but till the time we define the problem, till the time we understand what is to be treated, until the time we know that we are searching a remedy for what, till then all those whatever we know is of no use, does not help us at all. Because those prescriptions does not become homeopathic. They become homeopathic only and only if they are on the law of similia. Whatever it can cause, it can cure. And such a wisdom that Dr. L.M. Khan has shared with us. Thank you very much, sir. And I really congratulate you for arranging such webinars in interest of upliftment of the homeopathic fraternity. And quenching the thirst of quest. With this, I share my screen hereby. Today, on the same line that Dr. L.M. Khan sir has put us on the track, that the foremost thing, the first thing is the case taking, defining the case, and then deciding what is that is main core, the center of the case. Maybe it is a symptom or the observation or a conceptual understanding or whatever way we define the case. Now, the always challenging task is processing a case. We define the case. I'm not sure we always define it to the optimum level, to the perfection, but whatever best we can do, we have to deal with those data and reach to the level of the conclusion that is the remedy. So application of homeopathic fundamentals for processing a case, that is what I am sharing today. Hahnemannian homeopathy aims only at cure, nothing less than that. The target for a homeopath that is given right in the first aphorism, that you as a physician will not settle down with anything lesser if you understand that it is your duty. Then your job is to cure the patient, nothing else. Hahnemannian homeopathy is simple, focused, and evidence-based. It is so simple that just take data as it is, unaltered original data. You don't need to do anything. Just simply have a drashta bhav and take the data. Law of similia, very simple law of the nature. And here, if it can cause it, it can cure it. No complication. It is very simple and straightforward. Minimum dose. There should be everything that helps should be the minimum. And it should not be that we strive for the maximum. So with minimum if we can do the work. Otherwise, maximum will be the toxic. And simplicity is cure, restoring him back to health, nothing else. Very simple, straightforward point that Dr. Hahnemann has put forward, and he has also defined cure as rapid, gentle, and permanent in aphorism number 2. He said, we as a homeopath, or rather a physician, every physician should be focused and focused to defining what is to be cured in every case. We have to simply understand nothing more but focused and see the target that requires to be hit. What is curative in every drug? This is something very important that Dr. L.M. Khan sir also said, that once you decide what is a curative power of the remedy, that may take several hours of hard work, your diligence. But once you come to that, then you master the remedy. So what is curative in every drug? We have to be very focused, and for that, drug proving, whatever it can cause, it can cure. And what is to be cured in every case? For that, examination of every individual case, aphorism number 83. And for that, the target is the sick, aphorism number 1, and connect it with aphorism number 3. Homeopathy is a science right from the centuries. It has been defined. It is evidence based because at the footnote number 1, outrightly it has been stated, no speculations, no hypothesis, no imaginations. And hence, it is to be only and live only on the factual data, no speculations, and data has to be confirmed data. In aphorism number 85 onwards, what it states is you get the data, but you must counter check and confirm the data, and that is why examination and observation. Observation comes from the patient, observation comes from relatives or attendants, and observation comes from a physician himself. So this is something very important. Nevertheless, for that, who has to be very much prepared and efficient? Obviously, physician. And for that, Hahnemann has given a call, heal thyself. And for that, you make yourself free. So for the physician, freedom from prejudiced observations, disturbed senses, and untruthfulness or disloyalty. As a result, what will evolve is unprejudiced observer within us, sound senses, and fidelity of mind. This we have read, heard, and thought about thousands of times, but what remains is practicing outrightly for the benefit of the patient. That is what so many times we have the problem. Hahnemannian homeopathy evolves process of analysis, synthesis, and correlation. In analysis, classification of case data to individualize. So individualization through analysis. Synthesis helps us for the holistic approach, and correlation of law of similia. Now in the analysis, what is important that we require to put across in our every case that we process, and that is cause, deviation, phenomenon, morbid phenomenon, characteristic symptoms, ascertainable constitution and circumstances, and observations. This is something very important, that when we are analyzing the case, we have to categorize the data under these headings so that things become very, very crystal clear, that what will go into the core and what will go into the periphery. For the synthesis, we read Portrait of Disease and Totality of the Symptoms. To as per the time available, I will apply my case to best of my ability on this, and your comment will help me to make it better and perfect. Correlation, application of law of similia. For that, materia medica correlation is very, very, very essential. No compromise on that. No imagination, no hypothesis or any theories that this may be there. No, there is no may, there is no but. So, independent key to unlock every case is very simple. The bow of the key, there is law of similia, which gives us the strength to move the entire key, and the blade is fundamental cause that gives the strength to the characteristic symptoms. And most important is, when I am exploring any case, how much should I explore? I should be guided by the shoulder of the key, and that shoulder of the key, that is what is to be perceived in every disease. So, not to probe anything more than your interest, that is what is to be cured, and that is exploring the disease. Nothing more, nothing less. We are not here to write the biography of the patient. And the period of your entire key, that is at the tip, and the tip is on mind and disposition. And if we follow this particular key, then patient will get cured. Not only that, but it is stated 4. It means we will help patient to preserve health subsequently. Hence, every case needs a specific key, and there is no master key, no disease specific key, but a case specific key. So this is what is the case, and I will go little fast, but nevertheless you don't worry, because I have worked on your behalf. You just be with me and we understand this case. This case called me on 1st August on the lockdown period in the morning. There was a message in the WhatsApp at 4:38 a.m. that needed a help, and that help was required because seeking a relief. For since 2 days there was a suffering and there was no relief, and patient was very, very weak, totally exhausted, even not able to stand up. And home remedies did not give help, and considering the problem as an indisposition, wait and watch was taken up, but it was not helping, and request was that please give me the medicine. We can see here the sensitivity of the patient in the last sentence. I promise I shall take as less of your time as possible. The humbleness and the respect and the value given to the other person. With this background, we go further, that a 22-year female, a medical graduate, married, and currently staying away from the family due to medical duties, and that was explored on 1st August. So in this case, what is to be treated? In this case, whatever was to be treated was a diarrhea and insecurity, anal sphincter control. The beauty of this case was, we say beauty as a physician, but it was the great agony of the patient, that it used to start at around 2 to 3 a.m., maybe 2:33 a.m. or 2 o'clock or 3 o'clock. But it was around 2 to 3 a.m. and the diarrhea would continue till about 8 a.m., then whole day, no problem. This was something very periodical, and this was something very, very, very striking. Now, this diarrhea used to be very watery, profuse, urgent, gushing in beginning as if coming from the tape, and at one shot, 8 to 10 stools, but within one or two stools itself, patient was totally exhausted, and it was very much difficult for her to sustain. After 2, 3 stools, there used to be a fishy odor, sometimes, sometimes not, and there is no pain. Oh, painless diarrhea, profuse gushing, urgent, very simple remedy, podophyllum. Yes, we can jump on it. So let us see. Because when we are jumping, you have to understand that it can rebound and it can take us higher than what we are. Okay, the history is that trigger factors. Trigger is that patient had come across a COVID patient and then had taken arsenic dose also as a prevention and taken up biryani and chicken spicy food. So maybe this has triggered the diarrhea. Here the point is loss of control. That sphincter, no control. Urgency, no control. Gushing, no control. Very exhaustive, so no control on the system also. And patient was very, very, very hypersensitive. Let us understand in what respect it is. We go to the prodrome. Prodrome, chilliness, shivering, feverish feeling in the patient who is otherwise hot. And this is the time she has become chilly. So this is one deviation that we have got. Okay, great. And there is a sour eructations before diarrhea would start. So before the diarrhea would start at 2 or 3 o'clock in the morning, what would happen? The chilliness would begin and the sour eructation, there was an indication that now the diarrhea is going to set in. And patient was otherwise found to be very oversensitive. Others' pain felt on self, compassion, cruelty to animals, even plucking the flower, cutting the fruit, feeling that how much fruit is maybe feeling the pain, any harsh treatment to children. See the sensitivity, the fineness of this patient. Any noise used to startle. Mint and tobacco smell, mint of the toothpaste. So that was so much sensitive that patient left toothpaste from the 8th standard near close place. No way. She is otherwise hot. And sweets would create giddiness and heaviness of head. Spicy food always used to get her loose stools, but this time it was a profuse, watery, gushing diarrhea which was not stopping by itself, and it used to occur only at 2 to 3 a.m. in the morning. And she said she was very sensitive to drugs, whichever drugs, homeopathic drugs she took, say Netramure or any drugs whichever she took, she always proved the remedy. So now we are dealing with such a oversensitive patient. And here we find the deviation, hot to chilly, sour eructations, at the first instance, startled to noise that increased to manifold, even little noise. Oh, Asharam. Oh, any spider remedy? Yes, you remember that. And this patient otherwise is restless till set to order. Everything is to be in order. Not necessarily very clean, but if she is doing, it will be very, very, very clean. But the main point is there should be order maintained. If not, till then she is restless. Anxiety aggravates. At the same time, desire for soul right from childhood and very thirsty. Drinks water, plenty of water. Whole day she goes on drinking. We have got so many parameters, so many things. The current picture we have got, the prodrome we have got, the evolution that is we can see the basic mind and the disposition that is coming up in a way. Now what we don't have the fundamental cause of this case. Somehow this was missed out. Of course, later on I got the data, but I will give that at the end if the time permits. So portrait of disease, what is to be treated helps us to focus on our target, whereas portrait, as it is mentioned in aphorism number 6, it focuses on deviation, morbid phenomena, accidents, symptoms, observations, and obviously above aphorism number 6 is aphorism number 5, possession and various factors and ascertainable constitutional features. So keeping this in mind, we have to erect a portrait of the disease. So portrait of the disease, the mind that is already available to us, very oversensitive and others' pain. Even has seen parents struggle. As a result of that, she decided to restrict her expenditure and cut down all her needs. Any harshness and cruelty, even plucking the flower, that is what I said. Main important point, it should not pain anybody. Cutting fruit will pain. Plucking flower will pain. So that should not happen. And right from the early age, we see the sense of conscientiousness and responsibilities. So there is a precocity. There is oversensitive at the sensory part to noise, odor, and thermal. Okay. There is restlessness, anxiety. I have just arranged it again to understand what we mean by the portrait. Portrait means things at its right place, having its relationship with the other, so that it gives the wholesome picture of the disease. Now, disposition also, we also know sweet, spicy, aggravates, sensitive to drugs, desires salt and this and that. Predisposition, we don't know. Trigger factors, we know. Now, the evolution, the morbid phenomena means she came in contact with a COVID patient very closely, taking ECG on 26th July. Arsenic alb was given on 28th July by a teacher just as a routine precaution. Then on 28th July night, ate spicy food. And that caused the deviation. And we have the deviation from hot to chilly, sour erection, startled to noise to severe extent. And she used to wake up because of a startle with the lots of palpitation. And the deviation occurred on 29/7 after that biryani and the arsenic dose. At the night, she woke up with a diarrhea at around 2:30 a.m. with chilliness and feverishness, but no fever, and very exhaustive. The picture you know, and here is the picture. Okay, very, very, very highly exhaustive picture. So this is what is the portrait of disease. Now, erecting a totality of symptoms. So totality of the symptoms. After erecting the portrait of disease, aphorism number 7 writes, now, if you have not done 1, 2, 3, 4, 5, 6, till then don't do it. So if you have done it, then now you make the totality of symptoms. And basic thing in the totality of symptom is internal essence. What is totality of the symptom? Internal essence of the disease that we have to understand. And that is internal affection of vital force. We always, no patient is without circumstances, and circumstances are the main that we require to explore as per aphorism number 5. And totality of the symptom is the outwardly reflected picture of internal essence of disease. So here, this outwardly reflected picture is of the internal essence of the disease. So only on the symptoms, outwardly reflected picture, we should not be prescribing, but we have to understand what is the internal essence of the disease and what is it. It is the cause and mind and disposition. Cause, fundamental cause, as aphorism number 5 says, which is the main cause for every chronic disease. And unless we deal with this cause, mind and disposition, that is a core, that is the internal affection of the disease, unless we understand this, we cannot have permanent cure. And aphorism number 5, as you already know, and the characteristic, the outwardly reflected picture is the characteristic symptoms. Striking, singular, peculiar, uncommon. So we know from the portrait of disease and what is to be treated. So we know what is to be treated is the control system that has got affected, and with underlying features of mind and disposition. We have to connect that with the outwardly reflected picture, and outwardly reflected picture is very exhaustive with periodicity. So this we just do. A reportorial reference has been taken, and we see here that startling, there is the enhanced sensitivity, so it requires to be taken, and what requires to be taken is midnight after. It is a wrong rubric, it is 2 a.m., but it is never mind. And after midnight also we can take up in general. Another important feature is all the aggravations that season food every time that affects GIT, but more so at this point of time. And though she wants spicy food, but it always aggravates. Salty food, that is of a very high mark. See here, the current picture is taken along with the disposition. Aphorism number 122 that says, in acute disease, even in the acute disease, don't overlook the deviated dispositional features. And that is what we require to take it up. Otherwise, we will not be helping the patient to its roots. And here, we see the remedy that comes up is sulfur covering everything. But the point is, sulfur becoming chilly, and we require to address to such a sensitivity of the patient who is so compassionate, so loving, to the extent that it is not we are prescribing for the compassion and the love. That we don't need to remove unless they become the symptoms. They become the point of distress. And here they are point of distress because even plucking the flower, cutting the fruit, every animal, if are suffering, and she loves nature to very great extent and connects to the nature in terms of animal, plants, fruits, etc. So we require to have remedy which has such a sensitivity. If we don't do that, then we will not be touching the cause, mind and disposition. We have to see the mind and disposition to address not only characteristic symptoms, otherwise it will lead us to podophyllum and sulfur. So we have to understand such a sensitivity among all these drugs that comes up, that calls up, is where carcinosin. Though it is far behind, but this patient was suggested carcinosin, and as 1M was not available, 200 was whatever was available that she took next day morning. And after taking carcinosin 200, or that night she had one loose stool at around 2:33 a.m., but it was without any exhaustion, and instead of 8 to 10 stools, she passed only one stool. The point remained that what was she suffering from, and she was investigated considering that it was a COVID time and she had come in contact with a COVID patient, and COVID can represent itself only as a GIT disturbance, whereby one study was conducted by researchers. The 16% of the patients were having only GIT disturbance, and considering that here we find complete blood count where lymphocytes are raised and neutrophils are decreased. So here the ratio is altered. But here C-reactive protein was not altered. So we searched various other research papers. And in that we found that C-reactive protein is increased late in the later part in GIT affected patients than the respiratory affected patients, and the change, the raise in the CRP may be much lower degree than we find that in the respiratory problem affected patients. So here 2.79 on the 4th of August, where the problem was severe from the it began from 29th. So maybe we don't know whether we are early in assessing the CRP. Stool report we find here absolutely normal. So that showed probability is of viral diarrhea. If it is a viral diarrhea with altered lymphocytes and neutrophils count, then the chances of COVID cannot be ruled out, though C-reactive protein is 2.79, because a study says that in GIT affection, C-reactive protein may rise later and may not be as substantial as in respiratory cases. Lot of things happen and everything cannot be just I understand they cannot be dealt in just half an hour with the concepts and the case, but I would just put forward what is the final effect that was stated to me on 12th 11 2020. I can easily fall asleep as soon as I hit the bed at night, and I feel very refreshed after sleeping. In between she had a stress, and again once once peak of fever, and carcinosin 1m was available. She had taken carcinosin 1m, and then for about 2-3 months she did not take any other medicine, managed herself, and this is what she says on 12th of November, that sleep is much better. Before taking the medicine, I could not bear even slightest insufficiency of salt in my food. Now I can manage a little lesser salt once a while. So that disposition changes has started coming up. I can handle weakness better now. Have not had even a single episode of fainting after taking the medicine. She used to have fainting attacks, and that is also around the menses. So that has not occurred after carcinosin dose. I can bear thirst close to and somebody disliking me better. She used to be very thirsty, very large quantity of water, and she used to take very frequently. But now she can bear thirst. Closed room she cannot, but now she can. And somebody disliking me, which she was very sensitive, not able to stand earlier because of her oversensitiveness, now that does not matter much. Don't feel too suffocated in either of the above situation, which used to be there. So closed room and the tobacco that used to suffocate, that is not there. The feeling of longing for something to hold or hug has reduced a lot for good. Earlier, this used to be very severe urge to hug or hold on somebody. That had come up in the later part of the case, but I have just jumped over to this final conclusion. I don't get startled that easily now. And previously, I couldn't stand slightest bit of noise. Even now, I hate it. But I don't become too anxious about it. So those palpitations and anxiety that is come down. So now she is doing good. Since 2 months, again she has started having dysmenorrhea because she is passing through certain stress. But after repeating a dose of carcinosin 1 m on 12th afternoon, in the night she said she feels much relieved, all the stress has gone out, and she knows that she will be able to cope up with the situation. So this is the case, my dear friends, which I shared with you. And the case what demands is the good case taking. The good case taking means half the job done. But the rest of the half of the job requires proper case processing. And this is what I wanted to share, that Hahnemannian thinking and Hahnemannian fundamentals, how does it help us to come to the conclusion? And with that, I conclude here. Dr. Munjal is waiting for the next session, and I am sure he must have seen his watch more than a couple of times. So, Dr. Munjal, come forward, and I am eager to learn from you. And let us have the sharing and have more light on this Deepavali night. Thank you very much, Academy of Quest and the participants. If you have any questions, very quickly you may put across, or you may write in the chat box. If time permits, we'll address that later on. Choice is yours. It depends upon the host, how he wants to go about. So are there any questions, or somebody wants to comment or share something? Okay. So Dr. Munjal Thakkar, everybody is
Good evening.
eager to listen to you, and I switch off my video for you and audio for.
I like to see your face instead of your photograph. So thank you very much, sir. Wonderful presentation, very comprehensive. And I think this is so important and so rigorously needs to be practiced in every case. Because what I find in the present day, my students over the last 5-7 years is everybody is very good at case taking and everybody is even better at coming to the remedy without this interim process. So it's a very dangerous trend. And I think Sir's presentation really took those steps so beautifully. And when you do these steps, the results that you get are mind boggling. And this is no exaggeration. I feel And I have been very fortunate to being trained by Sir and many other teachers. In our days, 25 years from today, they would tell us the remedy is not important. What is very important is how you understand the case, how you process the data that is there in front of us. And today I find this whole processing is sorely missing. And I feel it's going to be very difficult if we don't come back to our basics. And today also, I practice what Sir has said absolutely to the T in every single case. There is not, in fact, my case paper, this will be a great time for me to show you my case paper, my case record in which I do my cases. So I think it's more relevant. So I will show you that instead of showing you my case. I will just share it, just 1 second. How do I do the screen sharing? Okay. So this is how I record each and every of my case. Now you can see what I have done here. I've just put the location at the end. We will not get into the nitty-gritty of all this, but I want you really to go back, see how the case paper is designed and what Sir was saying. The past history also has been split into LSMC. Also the family history. This is what aphorism number 5 talks about. The attending circumstances, the miasm that it is talking about. So one just does not need to, it's not just enough to just say, okay, father has got diabetes or father has got MI. I tell you this very interesting case that I made a prescription for yesterday. Young boy of 25 is a hypertensive and his blood pressure is 170 over 110 and not responding to any antihypertensives. And he had this very interesting family history. His father and his paternal uncle, they all had hypertension and all of them died of myocardial infarction at a very early age. So here, this counts for me. And for me, the most important thing in the case, the most characteristic thing in the case was to find a remedy that has the ability to affect the heart and the circulation, and then the rest of the case. And that really differentiated other remedies, this whole history. And what Sir was saying, you can see here, in the appetite section, I have written altered and dispositional. In the thermal thirst, altered, disposition. See the thermals, altered and dispositional. In fact, I would like to take this opportunity. So I'm deviating a little bit from my topic because I feel what Sir has said really, really needs to be emphasized. And I'm so grateful to him to have made this presentation. And this is my analysis, you can see. The altered state, actually the altered state also includes the past history and the family history. But just to highlight them, I have put it separately and then the dispositional features. And I will take 2 minutes, just 2 minutes, to point out something very fundamental, what Sir has mentioned from Bonninghausen's lesser writings. I will just open the book that I have got it here. So I think for all my, especially my younger friends, this part needs to be so deeply underlined, and this part needs to be really etched into your consciousness so that you never miss it at any stage of your career, however senior you be. Okay. Okay. Can you read, all of you, can you read these lines from quiz? Am I sharing it?
Yes, sir.
Yes,
Yeah,
sir.
okay. Yeah, so Boni Hassan in this chapter, uh, in his lesser writings, and you must not miss this chapter, read it over and over and over again, a contribution to the judgment concerning the characteristic value of symptoms. This is Boni Hassan's lesser writing, very easily available book, most neglected book. And there he says in the first part, as a matter of course, the personality, the individuality of the patient must stand at the head of the image of the disease, for the natural disposition rests on it. To this belongs first of all the sex and the age, then the bodily constitution and the temperament, both, if possible, separated according to his sick and his well days. That is, insofar as an appreciable difference has appeared in them. In all these peculiarities, whatever differs little or not at all from the usual natural state needs little attention, but everything that differs in a striking or a rare way deserves a proportionate notice. And this is exactly what Sir has said, and this is what exactly I have been practicing. I have been teaching again and again and again, and I had this opportunity to share this quote, where he says that if possible, separated according to his sick days and his well days. Now, this is something of practice. This is something that you rigorously have to do it. If you don't do it, it will not happen. If you try to jump from the case taking into the remedy, this will not happen. So you really have to make the habit of writing it down. You can see Sir is so senior at this level, and yet he has made those efforts to really put whole portrait into what was changed and what was not changed.